I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. Do you worry about forgetfulness or cognitive decline? Is there anything people can do to save their brains? This is the People's Pharmacy with Terry and Joe Graydon.
Dr. Dale Bredesen is an expert on aging and neurodegenerative diseases. He's developed individualized treatment programs for people with dementia. He'll offer his assessment of the brand-new Alzheimer's drug, Aduhelm.
Many neuroscientists now believe that beta amyloid is not the only factor in the development of Alzheimer's disease. What else should people be aware of?
How is it possible to reverse this devastating brain disorder?
Coming up on the People's Pharmacy, how the first survivors of Alzheimer's disease saved their brains.
In the People's Pharmacy Health Headlines, there's growing concern that vaccine effectiveness could be fading in older adults. Data from Israel suggests that people over 65 who were vaccinated last January are losing protection. Although the shots were initially highly protective, more recent data show 55% effectiveness against serious COVID infections. These data are preliminary, but the U.S. is beginning to detect similar trends. As a result, the feds are likely to recommend booster shots for healthcare providers and older people who were vaccinated in December and January.
Many Americans are opposed to COVID mandates or restrictions. They don't want to get vaccinated, wear masks, or curb their outdoor or indoor activities. But researchers maintain that early interventions do make a difference. New Zealand is an interesting model. It closed its borders early in the pandemic. Any Kiwis who returned to New Zealand or became sick were carefully quarantined. As a result of these strict measures, the country avoided the kinds of health problems most other countries have encountered. Of the 5 million people on the island nation, there were less than 3,000 cases of COVID, and only 26 people died. Ireland, another island nation with a similar population, has reported 326,000 COVID cases and more than 5,000 deaths. This week, New Zealand has detected its first local COVID-19 cases since February. As a result, the country has imposed a total lockdown. All businesses are closed except for grocery stores and pharmacies. Travel is severely restricted, along with all indoor and outdoor activities.
For years, public health authorities have advised us on how much vitamin C we need, based on research conducted during World War II. The British Navy had already ascertained that the vitamin was essential to prevent scurvy, but ascorbate-rich foods like lemons and oranges were in short supply during the war. In one experiment, conscientious objectors were deprived of vitamin C for a lengthy period of time. Out of the 20 subjects, 2 developed life-threatening cardiac complications. Eventually they recovered, however, and the British government set the minimum vitamin C requirement at 10 milligrams a day. That was the amount needed to prevent frank signs of scurvy and wounds that wouldn't heal. A new analysis of the data from this study 7 decades ago comes to a different conclusion. The original study had included experimental wounds and reports on scar strength. Modern statistical analysis reveals that the study subjects needed more than 10 milligrams daily to get their wounds to heal properly. According to the researchers, most people would need 95 milligrams of vitamin C daily to foster healing. Moreover, recovery from vitamin C deprivation takes longer and calls for more vitamin C than the original study concluded.
Colorectal cancer rates have been declining since the mid-1980s. That may be due in part because of regular screening through colonoscopy. But there is one group that's experienced a rapid increase in colorectal cancer. That's young adults under the age of 50. They've seen their incidence of this malignancy double since the 1990s. Investigators have speculated that diet, inflammation, and dysbiosis in the gut microbiome could account for the rise. A new study in the journal Gastroenterology suggests that lower levels of vitamin D may also play a role in the increased incidence of colorectal cancer. The researchers followed more than 90,000 women who participated in the Nurses' Health Study 2. It began in 1989. Regular dietary surveys revealed how much vitamin D these volunteers got from their diet. The greater the intake of this nutrient, the lower the risk of developing colon polyps or early onset colorectal cancer. The authors conclude, quote, "Our results further support that vitamin D may be important in younger adults for health and possibly colorectal cancer prevention." And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The FDA recently approved the first new drug for Alzheimer's disease in nearly 20 years. This decision ignited a tremendous amount of controversy. Many clinicians welcome the news, but others criticize the agency for approving a drug that does not seem to have any meaningful impact on slowing cognitive decline. It does reduce levels of beta-amyloid plaque in the brain, but is that enough?
To find out, we are talking with Dr. Dale Bredesen. He is an expert in aging and neurodegenerative diseases and a professor of molecular and medical pharmacology at UCLA. Dr. Bredesen is also the founding president and CEO of the Buck Institute for Research on Aging and the co-founder of MPI Cognition. His books include The End of Alzheimer's, the first program to prevent and reverse cognitive decline, and his brand new book, The First Survivors of Alzheimer's, How Patients Recovered Life and Hope in Their Own Words.
Welcome back to the People's Pharmacy, Dr. Dale Bredesen.
Thanks so much for having me, Terry and Joe.
Dr. Bredesen, the Food and Drug Administration recently stirred up what can only be described as a hornet's nest of controversy by approving the use of a drug called aducanumab, one of those monoclonal antibodies. It's known by the brand name Aduhelm for Alzheimer's disease. Now, you've been studying the underlying contributors to dementia for decades, and you've been seeking effective treatments. Why do you think the FDA's Aduhelm decision was misguided?
For many reasons, actually, and I think, historically it will prove to be one of the worst decisions ever made by the FDA. But certainly I understand on the positive side that the desire to do something, it's almost as if they were saying, we have nothing, so let's just do something, even if it's the wrong thing. But let's talk for a minute about the details, because they are quite damning, unfortunately. Number one, they convened a group of advisors, of expert advisors to the FDA on neurological diseases. There were 11 of them. Nobody on there voted that this should be approved. And in fact, 10 of them strongly recommended against approval, and the other one said that he didn't know. 3 of them, as you know, have resigned over the fact that they ignored the expertise of the panel. But beyond that, there are many issues. Let's start with the central one. The central issue here is that the fundamental rationale for why this was approved is counterfactual. So in other words, they said this is something where there isn't evidence. They specifically did not approve it to improve cognition, believe it or not. They said what this has been shown to do is to reduce amyloid. And then they took the next step saying, and we can reasonably expect that reducing amyloid will improve Alzheimer's disease. Well, that's exactly what the data showed is not correct. And furthermore, the data from multiple other antibodies prior to aducanumab all showed the same thing, The reality is when you reduce the amyloid, you don't reduce the symptoms. So this entire approval is based on a misunderstanding and a misconception. Then beyond that, there were all sorts of other issues. The various op-eds that were written for people in groups, for example, like the Alzheimer's Association, these were groups that were paid by the company. So Biogen, and this is public information, paid the Alzheimer's Association $1.4 million, paid Us Against Alzheimer's. And then these groups wrote, as if they were speaking for trying to improve people's health, wrote op-eds about why this drug should be approved. And this is highly unethical. And then beyond that, they're paying, various consultants, et cetera, who are then going out and telling people this is a good drug. This is not the way to approve a drug. So, problem after problem after problem. Let's talk about the trials. There were, 2 trials, of course, Engage and Emerge. In one trial, it was actually, there was no positive benefit. And in fact, it was a little bit worse than the control. In the other one, it didn't make people better. It didn't stabilize. What it did was only at one dose, it slowed the decline by 22%. So then, instead of evaluating all the data, they handpicked the data. And of course, this just drove the statisticians crazy. As the statisticians pointed out, you simply cannot do this. Now, and one appropriate response would have been, okay, please do another trial. One worked, one didn't. One worked at one dose, one didn't. Let's do one more trial. Instead, what was done was approval and then saying, well, we'd like you to do another trial within the next 9 years. Well, if it doesn't work after 9 years, they may remove it. But again, this is highly inappropriate. Again, decision after decision after decision. Of course, there was a clandestine meeting between a person from the FDA and the company. Again, highly inappropriate. All these things were just swept under the rug. So I think this, I think this will go down in history as one of the worst decisions by the FDA. And then, of course, the head of the FDA said that there should be an investigation. Of course, that's exactly what a person says when they're trying to keep their job. And so, again, detail after detail after detail. This just wasn't a rational decision. It wasn't an appropriate decision. And it was exactly what the 11 members of the expert panel said. This is not a drug that has met the level of drug efficacy for it to be approved. Now, beyond that, it is massively expensive. As has been pointed out, just the drug alone is $56,000 per year. But they will, you still have to have additional scans. You have to have infusions, on and on. So we're really talking about more like $100,000 per year for a drug that doesn't make people better. That's clear, and it doesn't stabilize. But at one dose in one trial only, it slowed the decline by 22%. But that doesn't come without very significant side effects. Cerebral microhemorrhage in 17%. Brain edema and abnormalities on MRI in 40%. And in the ApoE4 positive group, 50%. So lots of side effects. Lots of problems for virtually no efficacy with massive cost and a lot of under-the-table money. That's just not the way that we'd like to see a new drug. We're all interested in the same thing. Let's find something to make Alzheimer's better. And this is not it.
Dr. Bredesen, it sounds as though there's just so much money at stake that it distorted the whole process. But I would like to ask a really simple question. We're talking about amyloid. Why are we talking about amyloid? What is it? And why is everybody focused on amyloid?
And this is the fundamental misconception in the entire field. It's a little bit like saying we're looking for something to help people with leprosy, hundreds of years ago. And someone said, let's get a drug that removes the granulomas, not understanding that it's not the granulomas that are causing the leprosy. It's the actual mycobacterium itself. And so removing these granulomas doesn't do much for you. Now, in some cases it might help, but in some cases it doesn't. But it misses the whole point of what leprosy is. That's exactly what's going on in the Alzheimer's field. The Alzheimer's field has been the amyloid field for about 2 to 3 decades now. And again, it represents a fundamental misunderstanding of what this disease actually is. And so people thought, okay, because we know that if you have a mutation in your APP gene and that leads to more amyloid, you develop familial Alzheimer's. Fine, that's 5% of Alzheimer's is familial. But for the vast majority, for the sporadic cases, that's not what's going on. There are other things upstream of this. So amyloid is a response, and has been shown by Professor Rudy Tanzi and Robert Moyer from Harvard. This is a protective, this is a response. It's an antimicrobial peptide. And in fact, the amyloid is part of your innate immune system. We've all been suffering through the pandemic. And why do people die? Many times they die from COVID because of cytokine storm. And so we've looked at how to suppress that cytokine storm. Well, Alzheimer's represents something very analogous, but in that case, it's a cytokine drizzle. Instead of being over a few weeks, it's over decades that you have this ongoing mild inflammation. You have an ongoing innate immune system activation without the adaptive system doing enough to clear whatever it is. And we know now that there are many things. There's P. gingivalis from your dentition. There's herpes simplex, for example, from your lip. There are various tick-borne illnesses. There are various mycotoxins, and there are various fungal infections themselves. And all of these things have been identified by neuropathologists in various cases of patients with Alzheimer's. So the picture of Alzheimer's is really sharpening up. Just as this horrible decision was made, the picture is sharpening up, that we understand that this is a response to these various insults. And of course, we've all talked about this on your program previously. And this is the way to attack this, to understand why you're making the amyloid that is the response to these various pathogens, toxins, and reduction in energy and trophic support. The idea of just getting rid of it is extremely naive, biologically speaking, and therefore, no surprise, it hasn't worked.
You're listening to Dr. Dale Bredesen, an expert in aging and neurodegenerative diseases. He's a professor of molecular and medical pharmacology at UCLA. Dr. Bredesen is also the founding president and CEO of the Buck Institute for Research on Aging and co-founder of MPI Cognition. His books include The End of Alzheimer's, the first program to prevent and reverse cognitive decline, and his brand new book, The First Survivors of Alzheimer's, How Patients Recovered Life and Hope in their own words.
After the break, we'll learn about 36 dementia risk factors and why Dr. Bredesen likens them to holes in the roof.
He suggests that his treatment approach to Alzheimer's disease is more like surgery than medicine. What does he mean?
What's the empirical evidence for Dr. Bredesen's strategy against Alzheimer's disease?
Can his strategy work against other causes of dementia?
The changes that lead to dementia begin long before symptoms appear. Can people avoid decline with preventive measures?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
The People's Pharmacy podcast is supported in part by CocoVia, now offering its new cardio health product with 500 milligrams of cocoflavanols. This 100% pure Coco Pro cocoa extract formulation is backed by 20-plus years of research on cocoflavanols.
Cocoflavanols increase the body's output of nitric oxide to improve endothelial function, which results in enhanced blood vessel flexibility and better blood flow. More information at cocovia.com.
Welcome back to The People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon.
The People's Pharmacy is brought to you in part by Kaya Biotics, organic probiotic products made in Germany. KAYABiotics.com.
Also by CocoVia, now offering its cardio health product with 500 milligrams of cocoa flavanols. More information at cocovia.com.
When people begin to notice symptoms of forgetfulness, they may become fearful or even withdrawn. If they seek medical advice, they may be told it's a normal part of aging. Most people are not offered any way to stop or reverse their cognitive decline.
Our guest today has changed that. Dr. Dale Bredesen is an expert in aging and neurodegenerative diseases and a professor of molecular and medical pharmacology at UCLA. His books include The End of Alzheimer's and his brand new book, The First Survivors of Alzheimer's, How Patients Recovered Life and Hope in Their Own Words.
Dr. Bredesen, you've just explained why the simplistic idea that getting rid of amyloid is probably not just misguided, but ridiculous. And I'd like to go back to an analogy that you've used a couple of times on our radio show, and that is the idea of holes in the roof. And maybe as many as 36, and perhaps now you found a few more, and that trying to patch one hole, like amyloid, is just destined to failure. So could you please explain what you mean by the 36 holes?
It's a great point. So, it's interesting. We take it for granted that if we're going to develop a drug for something, like for Alzheimer's, that there must be an understanding, that we must understand this disease so that we can target the drug. But in fact, that's been the central problem in Alzheimer's disease. There hasn't been an understanding of what it actually is. And so people say, well, it's a disease of amyloid or tau, or it's, I'm sure you've heard people say it's type 3 diabetes, or it's a response to herpes simplex, on and on and on. There are dozens of theories, but none of them has led to a treatment that actually helps people. So therefore, if you look at what this actually is, which is what our research over 30 years looked at, in fact, this is fundamentally an insufficiency, but not a simple insufficiency, like if you'd have scurvy from a reduction of vitamin C. This is, in fact, an insufficiency in a complex network. This is a network of neuroplasticity. So you have these various subsystems within your brain, things that control movement, for example, that are, by the way, go awry in Parkinson's, things that control power, for example, that go awry in ALS. In Alzheimer's, the subsystem is a system of neuroplasticity, and there are four major groups that affect this. Number one, this is affected by various pathogens, anything that gives you inflammation. Number two, toxins. Number three, reductions in energetics. So anything that reduces your cerebral blood flow, your oxygenation, your mitochondrial function, your ability to use ketones to burn in the brain. And then number four, trophic responses. Anything that reduces your hormones, your growth factors like BDNF and NGF. So this is a situation in which the input to that system, the supply, is chronically exceeded by the demand. So what you need to do is to identify the reason you're on the wrong side of that equation, reduce the demand, increase the supply, and that's what's given the best responses so far. And you might want to remove amyloid, which is, again, a protective agent. It's telling your body to go into protective downsizing mode, just as our country did with COVID-19. We were told to stay indoors, social distancing, etc., sheltering in place. We did that, we were protected, and we went into a recession. That's what your brain is doing in Alzheimer's. You are pulling back. You can literally look at the molecular details. Your APP goes into a protective signaling mode, which is fundamentally different than the building and maintenance mode. So that's what you have to attack. And again, the idea of just removing amyloid is exceedingly naive and unfortunately unhelpful.
Dr. Brittis, in your new book, The First Survivors of Alzheimer's, How Patients Recovered Life and Hope in Their Own Words, covers the stories of 7 different patients who've undergone testing to find those 36 holes in the roof and which ones are actually leaking, and they followed individualized protocols to address their cognitive decline. You write, over the past few years, I've come to realize that the protocol my colleagues and I developed for cognitive decline is actually more like surgery than medicine. What do you mean?
Yes, good point. So when you do a surgical procedure, you have to do things in a specific order. You have to do a set of things. When someone says to you, well, can you just say, what's the number one thing you do for a liver transplant? Well, my gosh, you've got to have a sterile field, and you've got to make the appropriate incisions. It's not a simple prescription pad type of medicine. Whereas, of course, classical medicine, standard of care medicine is you ask what it is. Oh, is it Alzheimer's? Okay, then I'm going to write a prescription for drug A or drug B. That's not the way human physiology and pathophysiology work. So what we're finding is that, in fact, just as with surgeons, there are doctors who do the protocol that we developed very well and are getting almost everybody to improve. And there are other ones who are getting almost no one to improve. They simply don't have enough experience and expertise yet to do this. So, in fact, you have to practice a new kind of medicine where you actually use a personalized protocol where you understand what is high priority, low priority. Many doctors, when they first learn this, will say, well, I'll just use this part of it or that part of it because that's what I feel comfortable doing. But that's not going to help very many people. So you have to go after the things that are causing it, and you have to have appropriate priorities and appropriate follow-ups and appropriate optimization. So in that sense, very much like a surgical procedure.
Now, some of your colleagues have objected that there's no empirical evidence for your approach. Is that true?
Absolutely not. We just published a study in which we had a proof of concept trial in which 84% of the people showed improvements. Now, not slowing of decline the way you saw in the best case scenario with aducanumab, but actual improvements in their cognitive scores. So here's what they improved. They improved MoCA scores, the Montreal Cognitive Assessment. They improved CNS vital signs, which is a more sensitive online indicator with multiple subgroups, things like executive function, visual perception, memory, etc. They improved Brain HQ, which is a training module, set of modules. They improved their MRIs. So we actually saw improvements in MRIs, not side effects, not negativity, but improvements in their MRIs, in their gray matter volumes, and in their hippocampal volumes. So normally, even a normal aging person will have a slight decline over time with their hippocampal volumes. These people did better, even though they had mild cognitive impairment or Alzheimer's. They had some of both, very similar, actually, by the way, to what was in the aducanumab trial. They actually did better than the normal controls. So by all of these criteria, these people improved. And I should add also their partners noticed that they had improved as well. So we had a separate scoring system from the partners. So by all those criteria. Now, let's back up for a moment. When you're doing something new and different and saying, hey, the classic way is not the right way, of course, you need to start slowly. You need to start. We started, of course, and got turned down for our first trial in 2011. So we then did many, many anecdotes and published 100 anecdotes with documented improvement in 2018. We then went from that to a proof of concept trial, which is now public information. It's on medRxiv, which is the preprint server. And now we are going to the next trial, which is a randomized controlled trial. So, of course, you have to start somewhere. And this idea that, that there's no evidence, you're simply not reading the papers.
Dr. Bredesen, we've been talking about Alzheimer's disease and beta amyloid, but dementia could have other causes. For example, Joe's father had a severe dementia before he died. We discovered after his death, because we had signed him up for a brain autopsy, he had progressive supranuclear palsy. Mm-hmm. My mother has dementia, and her nurse practitioner thinks it's Parkinson's related, so perhaps a Lewy body type of
Right.
dementia. Do any of these other causes of cognitive decline respond to an approach like yours, an individualized protocol?
Yeah, that is a great question. And actually, we're working on that right now. So here's the point that we have to rethink, we have to reconsider the way we look at these diseases. As you know, this has been the area of greatest biomedical therapeutic failure. As they say, everyone knows a cancer survivor, no one knows an Alzheimer's survivor. Well, if you read the book, you'll meet the first seven. So, and there are many, there are hundreds and hundreds now by looking at the right thing and doing the right things. So, each of these different diseases, whether it's ALS, Lewy body disease, whether it's frontotemporal dementia, vascular dementia, what have you, each has its own unique biochemistry. But we believe from the research that each represents this same concept, that the supply is outstripped by the demand for many years. Therefore, no surprise, you have a downsizing of the subsystem that it is supporting. So that for each of these, you have to adapt it. Now, interestingly, we've had people with Lewy body disease already respond to the protocol because it is very similar to type 3 Alzheimer's, which is the toxic form. And we do typically find toxins with Parkinson's, with Lewy body, and with type 3 Alzheimer's. All of those seem to be commonly associated with toxin exposure. With others, we need to do further adaptations, and we're actually looking at the first patients with macular degeneration right now because it's, again, the same sort of thing. There is a subsystem that unfortunately is not supplied. It has a demand that exceeds the supply. We're adapting this in what we call the ARC project, ARK, just like the ARC had 2 by 2 by 2. This is small numbers of patients early in the disease state who are interested in being studied deeply. We want to know, okay, can we, if we now alter these, if we improve on this supply-demand ratio, can we see better outcomes?
Dr. Bredesen, we have heard from many researchers that dementia, whatever the cause, whether it's Alzheimer's disease or whether it's one of the other dementias that you've already mentioned, that it starts much earlier in life than people realize. That by the time somebody is losing their ability to recognize friends and family members or find words or be able to do the routine chores of daily living, that has been smoldering for a very long time. And I think a lot of our listeners know either a family member or someone who has had some kind of dementia, and they don't want it. They want to prevent this at all costs. And so the question becomes one of, well, what can people start to do long before they have symptoms, long before there's brain pathology? Is there some way to prevent the decline before there is decline?
That is maybe the most important point of all. So thanks so much, Joe, for raising that. Here's the thing. We used to think of this as a disease of our 60s, 70s, and 80s. We now know very clearly it starts at least 20 years before that. So this is really a disease of your 40s and even into your 30s. 40s, 50s, and 60s. This is a disease that is ongoing for years before you have a diagnosis. And here's the most important take home. No one needs to get this disease. Virtually no one. There are a few people with unusual mutations, but the vast majority of us really have Alzheimer's now as an option. If we simply get on appropriate prevention or earliest reversal, everyone does well. Here's why we've been shooting ourselves in the foot. What we call mild cognitive impairment is the third of the 4 stages of Alzheimer's. So every day in an office somewhere, a doctor says to someone, well, what you have is mild cognitive impairment. It's not that bad yet. Come back next year. What this should be called, this is like saying, you have mildly metastatic cancer. It's the same idea. This is a late stage of the problem. So there are 4 stages. Number 1 is where you are pre-symptomatic. So that should be called pre-Alzheimer's, just like pre-diabetes. You can already see the changes on a PET scan or in spinal fluid, but people don't have symptoms yet. That's when they should be getting on early treatment. And of course, we recommend that everybody 45 years or older should get on appropriate prevention. And we developed a program called Precode. Get your cognoscopy, just like you get your colonoscopy when you turn 50. Second stage, if you don't do anything about it, then you have mild symptoms, and that can go on for 10 years. It's called subjective cognitive impairment, and really should be called early Alzheimer's disease. It's early on in the process, and it's already the second of the 4 stages. The third stage, if you don't do anything during those 10 years, you go on to mild cognitive impairment. That should be called late stage Alzheimer's or advanced stage Alzheimer's. It's the third of 4 stages of this illness. And yet the doctors are still telling their patients, well, it's not that bad. Come back next year. Yes, it's very bad. It's a late stage of the disease. You should have jumped in before, or you should have been on prevention. But let's pull out all the stops and see if we can make you improve. And in our trial, we had people going from MoCA scores of 19 to 30. But no surprise, and 30 is a perfect score. No surprise, the later you start, the harder it is, the less likely it is to get a full recovery. Then the fourth and final stage is what we call Alzheimer's disease, where you're actually losing your activities of daily living. Well, that should be called end-stage Alzheimer's disease. That's a last stage. So we definitely, as you indicated, we need to move this whole discussion to prevention and early reversal, where we see virtually 100% response. We've never had anyone go on prevention who's gone on to get dementia. We'll see 20, 30 years down the road, maybe there will be someone. It hasn't happened yet. People who have SCI, subjective cognitive impairment, they're often told, well, it's just aging, it's just part of getting a little older. No, this is when you should be jumping on this problem. There are all sorts of things you can do. There are absolutely optimal protocols to make sure that you never progress and, in fact, that you improve. Even people with, quote, normal cognition can often improve their cognition and enhance their cognition, as you know. So, unfortunately, the semantics have hurt us. The approach we've taken has hurt us. We need now to bring this into the 21st century. This is modern medicine. Modern Alzheimer's doesn't wait until you have Alzheimer's. And in fact, in so doing, we can reduce the burden of dementia to virtually zero.
You're listening to Dr. Dale Bredesen, a professor of molecular and medical pharmacology at UCLA. Dr. Bredesen is author of The End of Alzheimer's and his new book, The First Survivors of Alzheimer's, How Patients Recovered Life and Hope in Their Own Words.
After the break, we'll find out what people can do to test their risk factors so they can prevent dementia.
What's the best path to stay cognitively strong?
Dr. Bredesen offers advice on finding a doctor who understands his protocol.
You'll also hear from one of the first survivors of Alzheimer's. Dr. Sally used the protocol to reverse her cognitive decline.
She learned about it from the People's Pharmacy. What's her advice for others?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
The People's Pharmacy podcast is sponsored in part by Kaya Biotics. KAYA Biotics offers the first probiotics which are both certified organic and hypoallergenic.
All probiotics are produced in Germany under laboratory conditions with high-quality ingredients and under strict regulatory oversight.
The 3 available formulas are created for very specific purposes, such as strengthening the immune system, fighting yeast infections, and helping with weight loss.
To learn more about Kaya Biotics probiotics and the important topic of gut health, you can visit their website, KayaBiotics.com. That's KAYA Biotics.com. Use the discount code PEOPLE for $10 off your first purchase.
Welcome back to The People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon.
The People's Pharmacy is brought to you in part by CocoVia, now offering its cardio health product with 500 milligrams of cocoflavanols. More information at cocovia.com.
And by Kaya Biotics, organic probiotic products made in Germany, KAYABiotics.com.
Lots of people would rather not be tested for dementia. If there's nothing you can do about it, why borrow trouble? But what if there were a way to counteract cognitive decline?
To learn more about that possibility, we're talking with Dr. Dale Bredesen, an expert on neurodegenerative diseases. His books include The End of Alzheimer's and his new book, The First Survivors of Alzheimer's, How Patients Recovered Life and Hope in Their Own Words.
Dr. Bredesen, you have given us a tremendous foundation, and your patients are clearly examples of success stories. Tell us what people can do in the way of testing to find out what's going on for them, what they might be able to do to prevent the development of dementia, and then perhaps provide some paths that people can take to stay cognitively strong into their 90s.
Yeah, great point. And of course, all of us should be actively preventing cognitive decline, especially those of us who have any family history of dementia. So as I said earlier, this is a bit like surgery. So you have to have a specialist who really can give you best outcomes, but you can do a tremendous amount on your own to get started. So there is a set of tests. Again, I mentioned earlier the cognoscopy, and that consists of three things. Number one is a set of blood tests, and as you might imagine, they are directed against the very things that drive the process. So we want to understand if there's ongoing systemic inflammation, and if so, what are the things causing it? Is this a specific pathogen that's been missed, which is common, by the way? Is this something where there's a leaky gut? Again, recognizing the microbiome and leaky gut is recognized more and more as an important contribution to many illnesses. Is this from poor dentition, for example? Is this from a mild chronic sinusitis? All these sorts of things can be evaluated. So a cognoscopy, again, three things: blood tests that look at the four major things I mentioned earlier, which are inflammation, the toxins, energetics, and trophic support. Secondly, it is a simple online cognitive test, because many people who believe that they're coming for prevention have already started down the road. When they actually get tested, they say, oh my gosh, I'm not doing as well as I thought I was. We had one, for example, who thought she had come in for prevention. Her MoCA score was 23, so that's already a very significant MCI. And by the way, she returned to 30 and is doing just great. And then the third piece is optional if you're asymptomatic and scoring well, and that's an MRI with volumetrics. If you have symptoms or if you're scoring poorly on the cognitive testing, you certainly want to include an MRI. But if you are asymptomatic and you're scoring well, you don't need to even include the third part. And you're absolutely right. So many people who have this in their families want to make sure that they never get it. And in fact, for the first time, we can tell you, yes, we can. If you do the right things, you are highly, highly unlikely to have this problem. So please get on appropriate prevention or the earliest reversal. Do not wait. Then, how do you translate all this? You want to look at things like HSCRP and things like if there are your oral microbiome and things like that. And then, as you indicated, translate that into a therapeutic approach. And we've developed a computer-based algorithm that does that. You can also look to see, okay, am I optimizing? There are basic things, which include your nutritional status, exercise, sleep, stress, brain training, specific supplementation, and detoxification. These are all critical things. But again, beyond that, if you've addressed those 7 things and things have still not improved, then okay, you need further evaluation. This comes up all the time. We'll see someone who's kind of plateaued. And one case, for example, it turned out to be undiagnosed babesia in one person. In another person, it turned out to be vascular issues that had to be addressed. And so again, there are different contributors, and there's often a rate limiting step for any given person. So this is a personalized precision medicine sort of approach. You can interact with one of the people we've trained, and we've trained over 2,000 physicians from 10 different countries and all over the United States. And so you can certainly look this up and go to one of those doctors.
That actually answers one question I was going to ask, which is, what if your doctor doesn't know anything about this protocol? And what you've suggested is that you then could find a doctor who has been trained. Where is that listed?
Yeah, you can just go to drbredesen.com, or you can go to mycognoscopy.com. We've worked with a group from Silicon Valley, Apollo Health, and so you can go to apollohealthco.com. The future of medicine is in larger data sets. It's in understanding the physiology, the why of the disease, instead of the 20th century approach, which was simply asking what the disease is and then writing a prescription.
Dr. Bredesen, when it comes to testing, you've mentioned inflammation a couple of times. What are the best markers for an inflammatory response in the body and presumably as well in the brain?
That's a great point. And so we'd like to understand if a person has systemic inflammation. And so starting with a very simple test, HSCRP, you want a high sensitivity C-reactive protein. Very helpful and often increased in people who have inflammation as a component of their Alzheimer's risk or Alzheimer's inciting factors. Beyond that, there are others, but really that are optional. So for some people, it's helpful also to know IL-6, for example, interleukin-6. Also, just knowing your ApoE status is helpful. If you are ApoE4 positive, and 75 million Americans have a single copy, about 7 million Americans have 2 copies. The vast majority don't know it. This is a pro-inflammatory gene. So again, you're going to want to push more on the anti-inflammatory and resolution of inflammation parts of the pathway if you are ApoE4 positive. And then simple things like albumin to globulin ratio will also give you really want to be up around 1.8 or above on your albumin to globulin ratio. So those are some tests that can be very helpful to get an idea of your inflammatory status.
And what's so nice about them is that any cardiologist can order a high sensitivity CRP because it's believed to be important in heart disease. So these are not esoteric, exotic tests. These are tests that any physician can order. Let's move on to the idea of pathogens.
Yes.
You've mentioned herpes, and of course, that has been highly controversial. It's rather intriguing, and most people do, in fact, have some evidence of herpes infections, whether it's a cold sore or genital herpes. The good news is that we actually have antiviral drugs that work.
Yes.
And work
yes.
amazingly well and have really, really few side effects. I mean, it's one of the great success stories in pharmacology. So there are going to be people who say, well, Dr. Bredesen, I have cold sores. Should I ask my doctor for generic Valtrex?
It's a great point. And the most compelling data actually come out of Taiwan, in which they studied people who had outbreaks in midlife and broke them down into 2 groups, people who treated the outbreaks and people who didn't treat the outbreaks. And the ones who treated the outbreaks had a dramatically lower, more than 50% lower risk of getting Alzheimer's disease. So it is pretty compelling. And again, we have to reorient our thinking. People have gone back and forth saying, is herpes the cause of Alzheimer's? Is it not the cause of Alzheimer's? Well, the answer is neither. It's a contributor in some people. So therefore, it's not the only cause. It's not the only contributor, but it is absolutely one of the potential contributors. So herpes family viruses, more so than other viruses, do seem to be associated with cognitive decline. And therefore, in the testing, good idea to look at your status with respect to HSV1, HSV2, HHV6, all of those, even CMV and EBV, all of those. And again, as you indicated earlier, easy tests that any doctor can order, but most of them do not.
Now, as we're talking about viruses and their effect on the brain, we do have a number of experts who are very concerned about the potential effect of SARS-CoV-2, especially since we've seen in long COVID, which is not uncommon, this complaint of brain fog or cognitive difficulty. What's your take on COVID-19 and the potential Alzheimer's down the road?
I could not agree more. This is an absolute concern. We already have 3 published cases, as you know, where people have published cases of Parkinson's that have come in association with SARS-CoV-2. So we're all looking to see, can we get better outcomes? What can we do for long hauler syndrome? What can we do to prevent down the line cognitive problems? And you indicated that brain fog is one of the most common associations with this. Of course, vascular problems occur, strokes, myocardial infarctions occur with COVID relatively frequently. So it definitely affects the vasculature as well. And of course, there have been a number of studies looking at SARS-CoV-2 in spinal fluid, in brain tissue. And so when this gets into the brain, it absolutely can impact the brain. And again, just as we are interested in prevention for anyone who's had any head trauma, car accident, played football, any sorts of things that have given you head trauma, you should be on active prevention. I would say the same for anyone who's had COVID. Please be on active prevention because, yes, it does impact the brain. We don't yet know if it's going to turn out to be a common contributor to future cases of Alzheimer's or if it will turn out to be an uncommon contributor. But nothing wrong with prevention. And no question, it has the profile of something that may turn out to be a common contributor. Now, the one positive piece here is, unlike with so-called encephalitis lethargica back 100 years ago, where it was clear these people had very significant encephalitides with a virus, then went on to have Parkinson's. At least you don't see that significant amount of encephalitis in the vast, vast majority of people with COVID-19.
Dr. Bredesen, finally, I have a question about prevention. And what I mean by that is, yes, we've all heard that, the appropriate diet, getting good exercise, sleep is essential, and, the common things that we've said on the People's Pharmacy for, almost 40 years. But what about supplements? What about nutrients? And what about sort of the idea of detoxification? It seems to me that you have a rather substantial list of things that people can take that are relatively benign, safe, and might pay dividends down the road. Could you just give us a list of things? I seem to remember something that most people have never heard of called Bacopa.
Yeah, this is a great point. And before launching into that, let me add wearables. Social networking and wearables are increasingly part of our armamentarium. We can now look at things like our nocturnal oxygenation, which, by the way, is very important for prevention of Alzheimer's, our heart rate variability. We can even do things like continuous glucose monitoring. Very, very important. Now, that one requires a doctor's prescription, of course, but really everybody should have CGM. And there are other things. You can look at your sleep status. You can look at your various phases of sleep. You can look at your arterial elasticity. We have an ability like never before. Now, this fits right into the supplements. So, okay, what sorts of supplements are important? And again, I was trained that, you didn't use supplements. Well, it turns out that using them in the right way and the right people at the right time, very powerful. And by the way, many people doing very well with them for COVID-19 as well. Things, using things like glutathione and vitamin C and vitamin D and zinc and things like that have proven to be very helpful. So for cognition, again, of course, it depends on what your rate limiting step is. Do you have more of an energetic issue? Do you have more of an inflammatory issue? Do you have more of a vascular issue? So forth and so on. So here's the thing. There are several that I think are very helpful for cognition. And again, depending on your own particular background, things like whole coffee fruit extract, which actually increases your BDNF. Very helpful. Making sure your magnesium is optimized, making sure your vitamin D is optimized. When my own father-in-law, a professor, developed Lewy body disease, and he was evaluated again at a time in the past when this wasn't looked at, he turned out to have an exceedingly low vitamin D in the teens. This clearly was a risk factor for him, and it was unfortunate that his had been so low. And so optimizing your vitamin D. And then, of course, things like resolvins that, again, you can get over the counter, very helpful to resolving ongoing inflammation. Of course, there are lots of studies on omega-3s and how helpful they are for people's cognition by multiple mechanisms. And then, of course, optimizing your glucose status and your fasting insulin status. For most people, that doesn't require things like berberine or cinnamon, but for some people, it's helpful to add that. So the reality is, we've been told that the armamentarium for Alzheimer's disease is zero. There's nothing you can do to prevent, reverse, or delay. That's the classic line. And so therefore, just get a drug. Well, nothing could be further from the truth. There is a huge arsenal for cognitive decline, including Alzheimer's, and therefore for us to use this optimally, and you mentioned Bacopa. Herbs have been used for thousands of years. Bacopa enhances your cholinergic signaling, and by the way, so do things like citicoline, developed by Professor Wertman out of MIT. Things like alpha GPC can enhance your cholinergic tone. Most of us don't get, as it turns out, enough choline. And so this is a critical one for the transmitter acetylcholine that's the most important one in Alzheimer's disease and the most important one for memory. Other herbs like ashwagandha, rhodiola, shankpushpi, Gotu kola, these have been used for thousands of years and actually can be very beneficial.
Dr. Dale Bredesen, thank you ever so much for talking with us on the People's Pharmacy today.
Thank you so much, Terry and Joe. And here's to safety and better health for all of us.
You've been listening to Dr. Dale Bredesen, Professor of Molecular and Medical Pharmacology at UCLA. Dr. Bredesen is also the founding president and CEO of the Buck Institute for Research on Aging and the co-founder of MPI Cognition. His books include The End of Alzheimer's, the first program to prevent and reverse cognitive decline, and his new book, The First Survivors of Alzheimer's, How Patients Recovered Life and Hope in Their Own Words.
We turn now to Dr. Sally Weinrich. She's a retired nursing researcher and nurse educator in South Carolina. Before she retired, she was active in prostate cancer screening research. She was aware that a family history of Alzheimer's meant she was at higher risk. Here's her story.
Welcome to the People's Pharmacy, Dr. Sally Weinrich.
I'm delighted to be here. I can't believe I get to talk to you, and I have my brain thanks to hearing People's Pharmacy 5 years ago about the very subject we're talking today.
Well, great. We really want to hear that story.
We are thrilled to be able to talk with you, Sally. First of all, Dr. Sally, you had reason to fear Alzheimer's disease. Why was that?
I had cared for patients with Alzheimer's. I knew firsthand, I'm a nurse, retired nurse, gerontological nurse originally before I got into cancer. I knew firsthand the daily hell that Alzheimer's patients go into or live on a day-to-day basis. And then I had two different aunts that raised me, and I loved them dearly and watched them gradually lose their personality. And then about 10 years after family members became aware that they had Alzheimer's, they died. But it was a painful, slow process for both them and family members, including me. So my biggest fear was to develop Alzheimer's.
And then you started developing symptoms. What symptoms were they, and what did you do?
There are different time periods at which I developed symptoms, and hindsight is brilliant. The one in 2016, when I can remember telling myself, Sally, forget the denial, you've got Alzheimer's, is when I forgot to pick up my 3 grandchildren to take them to school one morning, and my son had just called and asked me the night before. So there was no excuse for me to forget, but I forgot, and I would not ever forget to pick up my darling grandchildren.
What other symptoms were you experiencing, Dr. Sally?
I was having a lot of memory changes. About 2 years before this time, I started being aware that I had memory changes. I attributed them to normal aging changes. But interesting enough, the things that I and the literature says there's normal aging changes, like, for example, forgetting people's names or calling my grandchildren by the wrong name or walking from one end of the house to the other end of the house and forgetting what I went for. Those common symptoms that are often described as normal aging changes, I do not have now that I have regained my brain. I also had more embarrassing symptoms. I would stop in the middle of a sentence. I actively sought out research because I know research has a lot of answers to unknown problems. And I had enrolled in a research trial. And one time after I got the IV infusion for the research trial that I was enrolled in, I could not tell the difference between the traditional digital clock, not digital, but the traditional clock. I did not know which was the shorthand and which was the longhand for telling time.
So you were going downhill and you were worried. How did you learn about Dr. Bredesen's program?
I heard about it on People's Pharmacy, thanks to my husband. My husband is a religious, watches every one of your programs. And he and I both are retired researchers. And he is very good at finding different things that affect both our health. And he heard you on People's Pharmacy in December 2015. I heard you, thanks to him. I called Dr. Bredesen, asked him if I could enroll in his research. This was when his 2014 article had already come out, and on People's Pharmacy, he was talking about the 10 patients that he reported, that 9 out of 10 of them, he had reversed their Alzheimer's and got their cognition back. And I wanted to be like them. And I asked him if I could enroll in his study. I live in South Carolina. He was in California. He told me no because of research requirements of me being present. But he offered to help me and my physician. And thanks to his generous offer, I can think clearly. My brain is the best it's been in 21 years. And 21 years ago is when I first got exposed to mold in a home I lived in. And in retrospect, I recognize and now know, thanks to Dr. Bredesen's 2016 article on inhalation toxins, I now know that I first developed Alzheimer's in the year 2000 when I was living in a home with extensive black mold in the basement.
Tell us a little bit more about that, please, Dr. Sally.
At the time, I did not know mold was a problem, and I saw the mold in the basement. We did not correct it. At the time, I got depression, and I had taught gerontological nursing at the University of South Carolina. And part of my teaching was if the elderly patient, and at this time I was 50, has memory loss, first checked for depression, and the diagnosis was pseudo dementia. And the belief at that time was if you took care of the depression, you would eliminate the mental confusion. And indeed, I was very depressed, and I started on a antidepressant, which took care of my depression somewhat, not completely. And my memory problems cleared up somewhat, not completely, but enough to function and run a research grant and get major funding from the American Cancer Society and genetic funding from the National Institute of Health. So I was able to function, but my brain was not as sharp as it is now or as sharp as it was before 2000. I have one more thing to say about that as far as prevention, that I think it has a big part of Dr. Bredesen's protocol is lifestyle, and exercise and healthy eating is a key part of it. Once I started cancer research, I started on an anti-cancer diet. It is very similar to Dr. Bredesen's healthy diet, although he adds a lot more dietary recommendations. I'm making the point that prevention works. And I think I would have been like most of the people with inhalation toxins as described in Dr. Bredesen's 2016 publication if I had not been on my anti-cancer diet and exercise. And my exercise included 3 months plus of hiking 8 miles a day on the Appalachian Trail.
Dr. Sally, can you describe the reversal of your brain fog, what you were describing as sort of Alzheimer's-like condition? How did it begin to reverse?
First, let me give you the objective facts. I scored mild cognitive impairment on the Montreal Cognitive Assessment. I had enrolled in a nationwide research trial. I was using the objective measurement of subtracting 7 from 100 after each IV infusion to see whether or not, 1, whether I was in the intervention or control, and 2, whether or not the intervention was helping me. From that, I knew that my cognition was getting worse. So I dropped out of that research trial after 8 months.
And that was a trial of a medication that was supposed to get amyloid out of your brain. Is that correct?
Correct. And it made me worse. I can describe my symptoms if you want me to.
I would be very interested, Dr. Sally, and let me tell you why. I am sure you were aware that an anti-amyloid drug called Aduhelm was recently approved by the Food and Drug Administration, and it has been highly controversial because the clinical trials didn't show any really significant improvement in how people behaved, how they felt, even though it was extremely effective at getting rid of amyloid. Can you tell us a little bit about your experience? Because I suspect if you weren't taking Aduhelm itself, you were taking a drug like Aduhelm.
Yes, and I will tell you the name of the drug, Solazumab. And the trial ended in 2020. So you have to decide, I'll leave it to you to decide whether or not you name the drug, on the talk show. And the study was called A4. I don't remember any negative symptoms after my first IV infusion. After my second IV infusion, I was so irritable that my husband and I had a major conflict, and I took a taxi home.
Wow.
And that from Charleston to Columbia, which is like a 2-hour drive. And that's bizarre behavior. So it definitely caused irritability. It caused trouble sleeping. But I had the objective data of subtracting 7 from 100 after, or 101, 102, 103, I would alternate it. After I received the IV infusion, and each time I would get worse, not better. And the time that I described earlier when I could not differentiate the hour from the second hand on the clock, I did not know which was after IV infusion. I do not have the record of when I forgot to pick my grandchildren up because I was so horrified, but I believe, based on other negative memory experiences afterwards, that also was after IV infusion. I got the IV infusion once every month. So symptoms included definitely brain fog, definitely brain confusion, irritability, anxiety, trouble sleeping, and also trouble of problem solving. The thing I did not realize, I knew that Alzheimer's and problems with memory prevented you from remembering things, but I was not aware that it affects your problem solving abilities and simple things that you take for granted, that you think through each day. I lost those problem solving abilities.
Dr. Sally, were there any challenges as you started to follow Dr. Bredesen's protocol? Were there any difficulties with that?
Yes, I had to change lots of things.
Yeah.
And it's very hard to change one's behavior.
Yes,
and
it
there were
is.
lots of things to remember, and I couldn't remember. So I did lots of things that I mentioned in my book, and that indeed I had done research on. One was called Cues to Behavior. I would put notes in different places and alarms on my phone, and notes on my mirror in my bathroom, notes on the kitchen counter to remind me of what to do when. I also made electronic notes of what I did when, so I could remember it. At first, I was overwhelmed because I had 5 out of 6 types of Alzheimer's. And in 2016, when I had my first cognoscopy, Dr. Dale Bredesen knew of 36 different causes at that time. He's added more since then. And I was positive for all but one of them. I did not have Lyme disease. The rest of them, I needed improvement in. And so, yes, I was overwhelmed, but I kept the image of my mind of, and kept telling myself different forms of messages, which was, oh, now I get to pick what my brain does. And I can pick to do this today, or if I don't feel like it today, I can do it tomorrow. If I don't follow and do the recode, I won't get to pick. Someone else would pick for me. And I had seen Alzheimer's patients not understanding basic things like the need to go to bed or the need to shower or the need to move from one place to the other, and the anxiety and anger and stress it caused when they could not pick what they wanted to do.
Dr. Sally, tell me, if you can, all of the things that you've done. You've talked about sleep. You've talked about eating and nutrition. What are some of the supplements that you're taking? You've already described the exercise program that you are, very committed to. But if someone were listening and going, well, what did she do? How can I adopt some of these activities and supplements myself? Give us the essence of it so people will have a better understanding of all of the things that you did, including the supplements.
I'd like to repeat what I said that I was not doing, which I think it applies to most people, and that is the sleep and meditation or handling stress that Dr. Bredesen recommends. And he has wonderful chapters in his 2020 book, I think I've got the year right, on recommendations for both of those. As far as naming the supplements are specific to the type of Alzheimer's you have. I take a lot of supplements. I would rather refer your readers to Dr. Bredesen's book. Both his first book and his second book outlines the supplements that are needed based on the type of Alzheimer's you have.
Let me follow up then with one other quick question. Mold. You mentioned that you believe that the black mold in your basement in the house that you had been living in was a contributor, that your exposure to this toxin really was a big part of the problem. How do people who have been exposed to mold deal with it successfully?
With a lot of difficulty. First is not the problems of mold is in what's called functional medicine, in the treatment for functional medicine. It's not part of the standard physician training program. I followed the program of Dr. Shoemaker, who has a program for chronic inflammation response syndrome. the problem with mold and toxins is they get in your mitochondria, and the mitochondria is every cell of your body. And so the symptoms vary from person to person. In my case, it was depression, achy joints, vertigo, respiratory problems, definitely mental confusion, anxiety, and there may be some others I don't remember off the top of my head. Some people have cardiac symptoms. Some people have more respiratory symptoms than I do. Some people have major intestinal problems. Again, the symptoms vary, and that's part of what makes the problem, in that because the symptoms vary so widely, it's not well understood by traditional medical professionals, just because they haven't been trained in it.
And how do you deal with a mold problem? What were the steps that you undertook in the program?
I found online a physician who had been trained in the Dr. Shoemaker protocol. Since that time, there have been other physicians who've come out with books more recently on toxicity treatment. Dr. Shoemaker has retired. I found online a physician who had been trained in it, Dr. Thomas, who was in Myrtle Beach, which was 2 hours away from me. And Dr. Shoemaker's protocol was a 13-step process. I took 2.5 years to go through the protocol. I think because my genetic makeup was susceptible to more than one toxin and I was rare in my genetic makeup, I think I had more problems than most people. But I do agree with what Dr. Bredesen says, that type 3 toxicity is the hardest type to treat, but I'm a living proof example of that it can be treated. And I had problems with many indoor environments. My own home, I had complete mold remediation done in the home, everything vacuumed, including the walls and the chimney, and many other things. I now, though, am able to tolerate many other indoor environments, except for older buildings I still react to negatively and cannot go into them.
Dr. Sally, I wonder if you have any recommendations for others who might be especially vulnerable. Exercise, healthful diet, I'm assuming lots of vegetables and fruits. What else?
Yes, the mistake I made was sleep. I was raised on a farm, have a strong work ethic. I would quickly give up sleep for work reasons. Dr. Bredesen recommends, with good reasons, sleep of 7 to 8 hours a day, which I now get. The other thing which I did not do, that now that I wish I had, but I definitely do now, is meditation, prayer, mindfulness. There's lots of different forms of it, but if I had done the meditation, praying, mindfulness, and the sleep, I would have been a lot better off. I was taking some supplements to improve my brain in my 40s. I do believe that helped me. Dr. Bredesen says that the lifestyle is the main entree and the supplements are the appetizer, and I agree with that.
Now, Dr. Sally, to be very honest with you, a lot of our listeners and many health professionals who may also be listening are saying to themselves, this is impossible. This is bizarre. Nobody recovers from Alzheimer's disease. Nobody regains their ability to communicate or remember things. This Sally is an anomaly. She couldn't really have had Alzheimer's disease, and she couldn't make this incredible recovery and be talking to us on the radio with such clarity. So how do you share your experience with people in a way that they can actually understand what really happened to you?
I understand the disbelief. In fact, that was what I taught in nursing, that there was no treatment for Alzheimer's. And when I had tried to be tested for the APOE4 gene genetically, I was told no, because there was no treatment. I could not be tested. So I understand the disbelief. My answer is, if I can do it, anybody can do it. When I started doing it, Dr. Bredesen was very helpful, but I had 2 phone calls with him, a couple of emails, and 2 research publications. Today, there will be 3 books, a website, a health coach. I had to find and discover and decide what supplements to take, and I knew supplements were not regulated. Well, Dr. Bredesen gave me a recommendation based on my cognoscopy of what supplements I needed, but I had to pick out and decide where to order them from. And I knew from my nursing and health background that supplements are not regulated. Today, we have Life Seasons that provides the supplements that Dr. Bredesen recommends based on your problem. I had type 3 Alzheimer's, which Dr. Bredesen says, and which is certainly true, is the hardest type to reverse. I had 5 out of the 6 types of Alzheimer's. Most people have 1 or 2 or 3 types. I have reversed all of the types. I still have problems with my cognoscopy. I still have to follow recode on a daily basis. If I eat sugar, if I have too much stress, if I don't sleep, if I don't exercise, my cognition goes down. So it's a daily battle, but it's worth every second of it. And if I can do it, my immune system is susceptible to multiple toxins and also is very rare based on the research of a person who did the first research on toxicity, which is Dr. Shoemaker. If I can do it, you can do it. Because there are a lot more resources today. You probably don't have all the problems I have. And if you have any doubt whether or not the time, and there is a lot of time and there is cost to recode program, whether or not it's worth it, go visit an Alzheimer's unit and visit at times other than visiting hours. Then you'll know it's worth it. Every second of it is worth it. Every dollar that it costs is worth it.
Dr. Sally Weinrich, thank you ever so much for sharing your story on the People's Pharmacy today.
And thank you for my brain. I love it. I love it. And my joy in life with all my meditation and prayer and mindfulness now. I enjoy life more than I ever have. So thank you for People's Pharmacy, which is why I have my brain.
You've been listening to Dr. Sally Weinrich, a retired cancer researcher and nurse educator who is also one of the first survivors of Alzheimer's disease.
Lynn Siegel produced today's show. Al Wodarski engineered. Dave Graydon edits our interviews. B.J. Liederman composed our theme music.
This show is a co-production of North Carolina Public Radio, WUNC, with the People's Pharmacy.
We had extended conversations with both Dr. Dale Bredesen and Dr. Sally Weinrich. You can listen to the full interviews in the podcast. It's show number 1269.
You can subscribe to our podcast through your favorite podcast provider. We post the show on our website on Monday morning. You might want to share it with a friend or family member.
At our website, peoplespharmacy.com, you can sign up for our free online newsletter to get the latest news about COVID-19 and other important health stories. By subscribing to our newsletter, you also get regular access to our weekly podcast and find out ahead of time which topics we'll be covering.
In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thanks for listening. Please join us again next week.